Hi, my name is Julie, medical esthetician with the Bankston Center for Aesthetics and Plastic Surgery in Grand Rapids, Michigan. Welcome to our virtual event. We brought Sciton into the practice because number one, it is simply the best laser out there. It also helps us to treat a wide range of skin types, skin colors, and skin conditions. Sciton lasers are non-surgical and treat a wide range of skin issues from rosacea to sun damage, fine lines, wrinkles, texture, pore size, and helps to brighten the skin. A lot of times we will combine our lasers, such as BBL Moxie or BBL Halo, or we will triple stack with BBL Moxie and Halo. To address gals that have not only sun damage but deeper, coarser wrinkles would be great for BBL Halo. Patients that not only have sun damage and redness, but they also battle melasma is when we would incorporate BBL Moxie. With our BBL laser, which is broadband light, that allows us to address sun damage. It allows us to address rosacea. What's also great about BBL technology is with regular treatments, it actually turns back the hands of time. It helps your skin cells to start behaving like they did when you were younger. So with regular treatments, your skin actually becomes healthier. Then with Moxie, we can treat from light skin tone to the darkest skin tone with Moxie. So it's safe for everybody, and it addresses the fine lines and the pore size and helps to brighten the skin. And then for my older gals that are just coming into the game and they're wanting to address wrinkles and some laxity to their skin, we have Halo, which is ablative, non-ablative, that helps to address the wrinkles, address texture, address brown spots. With BBL and Moxie, maximum results are usually seen within 7 to 10 days. And with Halo, we say at day 14, you have what's called the Halo glow. As far as downtime goes, with BBL, it's pretty much no downtime. The biggest thing that you will have is any dark spots will be more prominent. You can certainly wear makeup the next day. Moxie, you possibly could be swollen the next day, but very little downtime. Typically, you are all back to normal within about 5 to 7 days, both with BBL and Moxie. Halo is a little bit more downtime. You've got about 3 days of some good swelling. And then you've got about a week of feeling like sandpaper and being pretty flaky. The top concerns that I'm treating patients for this fall, especially coming out of the summer, is sun damage. Those freckles, brown spots. Also melasma comes out hot and heavy in the summertime. And so Moxie is fabulous for my gals that suffer with melasma. Thank you for attending our webinar. Please stick around as Trisha and I are going to be answering your questions about laser.
in. We're so excited to have you here. I'm Trisha, an esthetician, and this is Julie. And so what we're going to have you do is just type some questions in the chat box, and we are going to try to answer all of those tonight. Just as a reminder, we're offering consultations the whole month of November and treatments through the summer. So we're really excited to see you also in person.
Okay, so first question we have, what skin types can be treated? Well, with BBL, it's usually Fitzpatrick 1 through 4. So, Fitzpatrick 5 and 6 is a no for BBL. Moxie, we can treat all skin types, all skin colors. Same with Halo.
Okay, so the next question is, how many treatments do I need? So that really depends on the laser and the patient. Some people just need one treatment. It could be multiple treatments. So the best thing to do is to have that consultation so we can really customize your treatment and decide which laser and how many treatments you need is best for your skin.
Let's see. Will the skin continue to change in appearance after the Halo? Yes, you get your full effect from Halo in about 3 to 4 months.
All right. What is the frequency for a regular treatment? Again, that just depends on the laser that you're getting and your skin type. I had 4 BBLs. I loved them. And now kind of my thing that I like to do is do 2 a year to really maintain my skin and keep it healthy.
What is melasma? Melasma is a hormonal pigmented condition of the skin. Typically women get it from taking birth control and mixing that with sun exposure, or pregnancy will bring that on. It's a very difficult condition to control. We can't cure it, but we do control it pretty nicely with Moxie.
Okay, what laser is best for the upper lip area? Again, that could be BBL, it could be Moxie, it could be Halo. It depends on how deep your wrinkles are, if you're trying to treat wrinkles or if you're trying to treat brown pigmentation. Any of those lasers could address that issue. So that's why, again, it's just dependent on the person.
What specific treatments or combo of treatments did the guy with the broken capillaries have? He had BBL Moxie treatments.
Which is best for acne scarring? So definitely a Halo treatment is our go-to laser for acne scarring.
What's the best treatment for your chest for sun damage? First of all, BBL, but I love to do a combination of BBL Halo on the chest for sun damage.
What is the pain level for Halo? So we actually numb for Halo. Most people are going to experience a little bit of discomfort, but for most people, it's very tolerable.
How long do these procedures take? BBL, typically about 30 minutes. Moxie, you're numbing for about 20 minutes, but once we get a hold of you, about 10 minutes to do a full face, if that.
Is BBL and Moxie done on the same day or the same treatment? Yes, this is this is a great treatment to have. It's I think it showed me in the video having this done. It's great. You have BBL first, so that's going to treat your browns and reds. And then we do Moxie right over that to make it just a great combination.
Do the results that you shared stay until regular sun exposure again? We will clean up past. You will always be having sun exposure. It's layers deep, so you're always going to have things coming out. So that's why there's usually regular treatments, because we're constantly having to clean up all the years of naughtiness from, being a teenager up until now.
Is it common to do BBL and Halo at the same time? Again, that's another great combination treatment. It doesn't add much time to do them both together, and you're getting the treatment for browns and reds with that BBL, and then the Halo is going to go deeper for fine lines and wrinkles. So a great treatment to have.
Will this help with frown lines and loose skin on the neck? And for loose skin, will it take more treatments? It can help soften the lines, and it can help with a little bit of laxity. It's certainly not going to be surgery.
This is a good one. I have rosacea. Is it okay to do a laser treatment? It's fantastic for a laser treatment. You will love this. It's going to make your life so much easier, clearing up some of that red. We see great results with the BBL with rosacea clients.
Can you do laser along with Botox? Not on the same day. Typically, we wait 2 weeks in between. So if you want to get your laser done first, you'd wait 2 weeks to get your Botox, or flip that.
Is Halo the strongest? Halo is the strongest. BBL is kind of going to be your entry level. Moxie is going to be a little bit stronger. And then Halo is going to be the strongest laser and the deepest laser that we do.
How long have you been doing Halo and Moxie at the Bankson Center? We have had the Sciton technology for a little over a year now. Me personally, I have worked on it for 4 years.
Yes, you can. This question is, can you combine laser, different lasers in one visit? You can do that. You can combine BBL with the Moxie, the BBL with the Halo, or some people can do something called a triple stack, which is actually doing all 3 lasers at the same time.
What laser is best for broken capillaries? BBL.
Is Moxie and BBL something you can do every year? Absolutely. It's a great way to maintain your skin. The beautiful thing about it is it's reversing your aging. And so, of course, we all want to do that. So it's a great way to maintain and do preventative treatments to your skin too.
Mm-hmm. Lasers are going to be very addictive, ladies. Mark my words. How do you know if my brown spots are sun damage, age spots, or melasma? Well, usually the sun damage and the age spots, freckles, all type of sun damage. Melasma is, you will see a pattern on the face. It's usually, big pigmented patches here. Some women get it right across the lip. And some women will have like a 5 o'clock shadow. So it's pretty easy to pick out the difference between melasma and sun damage.
How long does it take before you notice a difference with pores and wrinkles with BBL and Halo? So with BBL Halo combination, do we say like 11 days is when they really start to see that glow and change in their skin?
Yep.
And then about 3 to 4 months is when you'll really start seeing a difference as far as those wrinkles. But about a week after, you're just going to be shocked how great your skin looks.
So deep wrinkles above the lip, I'm most concerned about. What is the strongest laser for that? Halo.
Can you really have all 3 treatments together? You can.
You can. If you have filler, should you avoid these lasers for a period of time? Couple weeks, same as like Botox. If you've had filler, you're going to just want to wait a few weeks. A lot of times though, if you've never had filler, I usually say, get your lasers done first, especially Halo, because we want to see the collagen that's been stimulated, and you might not need as much filler.
Is 66 too old to start lasers? It's never too old to start lasers.
No.
Will there be any Thanksgiving or Black Friday specials? So we are having specials for the laser treatments right now. If you schedule a consultation, again, you just have to do it in the month of November, and the savings are fantastic. So you're going to save anywhere from 15 to 25% off your laser treatments. So again, just get your consultations in. We're going to reach out to you and get you guys scheduled for your consultations.
What does it feel like after having BBL and halo? You're going to feel like you have a pretty good sunburn. You are going to be throbby, stingy, like you laid out at the beach all day long without a stitch of sunscreen on, and got burnt to a crisp. That's how it's going to feel. But usually that dissipates within about an hour and a half, surprisingly. And then for, the rest of the day, evening, and maybe into the next day, you're probably just a little bit tender to the touch, but then that settles right down and you just feel like sandpaper.
Is there a recommendation of order to maximize your results if you want to incorporate lasers with microneedling and your hydrofacial routine? This is a great question. That really kind of depends on the person, their lifestyle, when they travel. Definitely, we want you to be doing all the things, hydrofacials and lasers and microneedling. But it's definitely specific to your lifestyle. Some people go away for the winter, some people stay. Most people, it works really well to have lasers right now when it's a little bit cooler and we're not seeing the sun, and doing their microneedling and hydrofacials year round, and then they like to do their microneedling in the summer months. But again, it's very dependent on the person and their lifestyle.
Moxie can also be done all summer long. Oh yeah. People, as a reminder, you will be receiving a text message, and please reply with the code word LIGHT to be contacted for a consultation.
How far apart should I have my Moxie with BBL treatments? So again, we can do that the same treatment, the Moxie and the BBL. Some people like to do those a little bit closer, around 4 to 6 weeks.
Should I avoid exercise with recovery from lasers? Yes, with BBL, typically 24 hours, just let that heat dissipate. Moxie's 48 hours, and halo about a week and a half.
Okay. If I'm having Moxie with BBL, would you recommend a facial a few weeks later? I actually love that. It's a great way to get off your dead skin and rehydrate your skin. So personally, I love having a BBL Moxie and then coming in 3 to 4 weeks later for a hydrofacial.
Yep. If I've already had a mini consult as part of a previous appointment, hydrofacial, am I still able to get the discount? Yes.
Is there a fee for consultation? There is no fees for a consultation. We're happy to see you and evaluate your skin and make a treatment plan that's personalized for you.
Do you want me to do that one? Okay. Could a laser procedure be done at the same time of consultation if I decide to go ahead with this? If that laser is available, we will get you in.
Do you do virtual consults? We do. Yep, virtual. We can also talk to you over the phone if that's ever helpful, but virtual and in person. All right. Thank you so much for joining us. We loved all the questions, and we're looking forward to seeing you for a consultation.
Bye.